Good morning, everyone. My name is Maya Luria with TMC for Seniors, and today we're going to be talking about Medicare. There are quite a few changes that are coming up, so this is your Medicare update for 2025. I have Linda Kamalo here with me. She is with Pima Council on Aging. She runs the Medicare program over at Pima Council on Aging, and she's going to share all about all the updates. I know, Linda, when we spoke, you said there are some very important updates in 2025, right? So you'll be able to share those with us today. You do have an online audience that's watching, along with an in-person audience. So if you have questions for Linda, please put those in the chat, and we will address those afterwards. Linda, I'm going to turn it over to you.
All right. Thank you, Maya. Good morning, everyone. My name is Linda Kumalo. I am the Medicare Program Supervisor with SHIP, which is the State Health Insurance Assistance Program. I have been with Pima Council on Aging for 5 years, so this is my fifth year working on this Medicare business. So today we're going to talk about what you can expect for Medicare from Medicare for 2025. So before I start talking about that, let me let you know that Pima Council on Aging is the area aging agency serving all of Pima County. And what we do, we provide services to older adults from ages 60 and above for everything that you need assistance with here in the county. You can call us or you can go to TMC for Seniors. They do just pretty much the same things that we do, which is why we collaborate with them. And what I need to let you know as well is that while I'm going to be talking about Medicare, we do not sell or endorse any plans, which is why when I have all the spreadsheets for you, I give you everything that's available in Pima County. Our mandate is to give you unbiased information. We are funded by the Center for Medicare and Medicaid Services through the Administration for Community Living to making sure that we ensure that you guys know the information that you're getting, that it's correct, and you know how to make decisions, and then you can go work with your agent and a broker that you trust. But you can come to us to do your research and find out anything that you need to know about your Medicare and make sure you make informed decisions. Again, if you need to call Pima Council on Aging for anything else, the number is on there on the screen, 520-790-7262. And if you need specific Medicare information, you can either call Jennifer here at TMC for Seniors. We collaborate with them throughout the year, or you can call us directly at 520-546-2011 or email us at SHIP. Again, SHIP stands for State Health Insurance Assistance Program at pcoa.org. All right, now you know, and I know everybody in here and online knows that this is Medicare open enrollment. If you didn't know, then you must have not been listening to your radio or turning on your TV, or you're not checking your mailboxes. But this is the time that comes around every year. This is the moment where you can review your plans, and we advise everybody to review their plans to make sure that they're in the correct plan, whether you're on Medicare Advantage or you're on traditional Medicare with a standalone plan. So here are the things you can do during this period of October 15th to December 7th that comes around every year. You can enroll in a Medicare Advantage plan. If you were in traditional Medicare, that's what some people do say, no, I just want to go to Medicare Advantage plan. Or you can change a Medicare Advantage plans if you're already on Medicare Advantage plan. Or you can then pick up a standalone plan, which is standalone Part D that covers your prescriptions, or switch standalone plans that we'll talk about so you'll know how many options you have. What you cannot do this part of during this period, this is not the time for people who are enrolling in Part A. That's a different period for a person, say you're turning 65 and you're new to Medicare. It doesn't necessarily fall under open enrollment. It falls in your initial enrollment period or your special enrollment period. Same thing for Part B. This is not necessarily the time to do so. Or enrolling in a supplement plan. Supplement plan, you can enroll anytime throughout the year. If any plan will have you and you have your Part A and Part B ready, that can be done at any time of the year. It's not limited to this open enrollment period. Or this is when you can change supplement plan. Again, not that you cannot, but you can do that anytime. It's not necessarily, this is my chance to do so. However, If you're leaving Medicare Advantage and coming back to traditional Medicare and picking up a Part D plan, this may be the moment to consider reviewing your options when it comes to Medicare plans. Now let's talk about Part A and Part B, what they cover. So traditional Medicare, or some people call it original Medicare, basically you can see any provider in the United States from coast to coast within the United States who is accepting new patients. We say who is accepting new patients because sometimes the doctor does accept original Medicare, but they are not taking any new patients. Doesn't mean that they don't accept Medicare. It just means that their roster is full. So you can see any doctor. If you decide you're going to Massachusetts right now, you want to do that, there is no network that confines you to Pima County. What does Part A cover? It's for inpatient services. If you're in the hospital for medical issues, or you're in rehab and skilled nursing facility, not long-term, not for long-term care. That's a different program altogether. Pretty much it's Altex here. Just for those, maybe you've been in the hospital for 3 days and they send you to rehab or skilled nursing facility to continue your recovery. And Part A also covers hospice care. What Part B covers, what we like to say typically is it covers everything outpatient, your doctor's visit, including your observation status, by the way. When you go to the emergency room and they don't know what exactly is going on with you, they're still running tests. You are not inpatient, but you are very much in a room like a person that's in the hospital. That's called observation status, and the doctor hasn't admitted you into the hospital as an inpatient. What that means is Part B is going to cover. You're still an outpatient person. That's what Part B covers. And then the doctor's services, of course, as I mentioned earlier, everything when you go to your doctors, your MRI screening, diagnostics, test, X-ray, CT scan, everything that you do without having to go stay at a hospital is covered by Part B, including the durable medical equipment. That's your walkers, your wheelchairs, your hospital beds, anything else that's supposed to help you with your health. And it also covers emergency and urgent care and ambulance to the nearest hospital. When we say to the nearest hospital, during an emergency and they take you to the nearest hospital, Medicare Part B will cover that. Not if you are in a particular place and you need transportation to go to an appointment. That may be an issue that you may need to check first. It has to be an emergency to the nearest hospital. So here we are, it's November 5th, and usually by this year, we know exactly what Part B premiums are going to be. Has anyone heard anything about what that's going to be? No, we just have speculation, and we try not to put, what people are speculating would be the cost for Part B next year. But this year, rather Part A, this year what we know is that for people with 40 quarters, that is if you worked for 10 years and you've paid into Medicare, you don't have to pay anything into Part A. You just sign up and you have Part A. But if you're somebody who's worked less than 10 years, which we call from 30 quarters to 39 quarters, I'll say, that will be $278. And if you have nothing at all that you've paid for into Medicare, $505. That number is going to increase. Most times that's not an issue for people because a lot of people have worked 10 years or were married to somebody who was, even if you were a stay-at-home spouse, if you were married to somebody who was paying into Medicare for 10 years, then you don't have to pay Part A. We call it premium-free Part A. And these are the figures, the deductible this year, if you're going to the hospital, that is the amount of money that you pay before Part A pays the remaining cost at the hospital. They say it's $1,632, and then we still don't know what's going on, what we'll have next year. Hopefully we'll have it before the month is over. So if you need to know that information, call us again, and we should have it. Check with us. Once we have it, we'll put it out there and let everybody know. But right now, as you see those access, we don't have those numbers. The Center for Medicare and Medicaid Services hasn't told us yet. And those are the other figures. They usually increase maybe by $5, $10 or so, and sometimes they stay the same. But again, we don't know what 2025 is going to look like in this regard. And this continues the same information. 2024, we have it. If you're in a skilled nursing facilities with traditional Medicare from 0 to 20 days, you pay nothing. From 21 days to 100 days, it's $204 this year. We've got one month to go with that. Really, this information is about to expire. And then 101 days and above, you pay the full amount, the full cost for staying in a skilled nursing facility. These are the other things that they cover. Inpatient mental health facilities, same as inpatient hospital facilities, same prices. The premiums for this year, you all know that they deduct $174.70 out of your check, and have no idea what it's going to be next year, but we should know by the end of the month. Same as the deductible. This is the amount that you pay when you go to see your doctor as a traditional Medicare patient. You pay $240 before Medicare picks up, and then your supplement pays the difference. Now, we know about prescription drug coverage. I was talking to somebody about coverage and when do I get a standalone plan and should I get one? Well, first, in order to get a prescription plan, if you're going for a standalone plan, you have to be enrolled either in Part A or Part B. You don't have to have both. Some people will have Part A and then have a standalone prescription plan, not sure what they have for Part B, maybe some other secondary insurance. This is for original Medicare. You have to have a standalone plan. Otherwise, there's a penalty to go with that. For Medicare Advantage, which is what we call Part C, it's already included with the plan. So each plan has a formulary, and the formulary is the list of drugs that they cover. This is the part that has us kind of wanting everybody to pay attention to their plan, because the formulary varies from plan to plan. If you've got a standalone Part D, they may cover this set of drugs this year. They need to only cover 2 drugs per tier. There are 4 different tiers that they have, sometimes 5. The cheapest all the way to the most expensive drugs. And the Center for Medicare and Medicaid Services asks them to cover at least 2 per tier. Now, with all these changes that are coming, we are seeing a redesign in plans that are covering it. So we ask you to make sure that whatever plan you move forward with actually has your prescription on their list, because they vary every year. If you're not in the right plan and you keep your same plan and you're still taking the same drugs only to find that your drug is no longer part of your current plan, you may end up having to pay full price for the prescription, and we don't want that to happen. It's costly. Now, how many plans do we have for standalone Part D? This year in 2024, we had 21 plans available in the state of Arizona that you could choose from. Their premium ranged from 0 all the way to $158.60. And the deductible, the maximum deductible that you would have to pay before the plan takes over everything, this year was $545. The national base premium, that's the premium that they look at the average cost of a plan. And where this comes into play is when they decide what the penalty is going to be for not signing up for Part D when you should have at age 65, because they tell you don't have to. But if you do want to start signing up for a plan somewhere down the line, there's going to be a penalty for every month you did not have coverage. And that's 1% of the national base premium. Believe me, we see people with $80. So whatever premium you have for your plan, if you say you choose a plan that's 0 premium per month, and then they take on that $80, it doesn't go away. It increases every year as premium increases. So we always tell people, don't say, I'm not taking anything. I'm 65, I'm healthy, I only take multivitamins. Because as we get older, really wear and tear gets to us. You will be taking something most likely. So take the cheapest plan to make sure that you don't get the penalty for not being enrolled in any plan at all. The LIS, that's limited income subsidy benchmark, this year is $43.18. That's for people on limited income. They can sign up for their plan. They can sign up for plans that are subsidized all the way up to $43.18 per month, and they don't have to pay anything. If they do sign up with a plan that's more than that, they may have to pay the difference. 2025, now this information we have because Everybody has been talking about the changes that are coming up in in the prescription coverage plans. For 2025, now with all the changes they negotiated, the maximum out of pocket changing, we are now down to 12 plans. By the way, last year in 2023, we had 28. We lost 7, and then this year we have 21. Come 2025, plans have consolidated, and a lot of them have left our market, and so we're down to 12 plans to choose from. Again, I say, make sure your plan is still in Pima County. Make sure that you select the right plan during this period because the changes are big. Now, the monthly premium for next year will be ranging from us. We'll still have those zero premium plans. Thankfully, there are 2 of those that are zero premium per month, and one of them is even 80 cents a month. Don't know why. That's how you know that everything has been calculated to a T. So you do your part and make sure that you're in the right plan. And the deductible, the amount of money that you have to pay before the plan takes over, is $590 maximum. The national base premium that we talked about, the 1%, whoever has been paying that 1% penalty, they're no longer going to be paying the 1% of $34.70. It's going up to 1% of $36.70. And they're going to have that penalty for the remainder of, as long as they're enrolled in Part D. It's going to keep going up as the national base premium goes up. The benchmark for subsidies has come down to $30.10. We only have 2 plans now in Arizona that are for people with limited income. This year we had 7. Next year we'll have only 2. This is the big part that I keep talking about, that we keep telling people about, and you probably have had enough about it in the news about the changes, the capping at $2,000. What this means is, once you have paid $2,000 out of pocket in co-pays and in deductible, and it all has come up to $2,000, then the plan will take over everything. You won't have to pay anything afterwards. Now, this is not that big of a deal for people who are taking generic medications, but you know that there are people who are taking expensive medicine. There are people who will reach their $2,000 by February because their medications are that expensive. Now, this year, that cap was $8,000. People had to pay up to $8,000 before getting some kind of reprieve, and the insurance pays the prescription for the remainder of the time. What this $2,000 does not include the deductible, or rather it does include the plan's deductible. As I said, the deductible and the copays are part of this $2,000. They add up. Once they add up to $2,000, then you're done and the insurance pays for everything. What it does not include is the cost of drugs that are not in the plan's formulary. Again, this is where I say, please make sure that you have your drugs are in your plan. Because if your drugs are not in your formulary and you have to pay for them out of pocket at the cost, whatever they sell them for you, it doesn't count towards the cap. Does that make sense? It doesn't count towards the cap. The only amount of money that counts towards the $2,000 cap is the cost of your drugs that are in your plan's formulary that the insurance has agreed to pay for. It's your premium, rather it's your deductible and your copays, not the premium. Of course, next line, it does not include your monthly premium. It does not include the late enrollment fee that I just talked about, that some people signed up late for Part D. Somebody did ask me, say, well, see, I'm paying $80 a month for this. Will that count once I've reached? They were thinking maybe we'll get them to 2,000 quicker, but no, this is not part of it. The other new thing that has come up that's great, I've got some handouts here if you want to read more information about that and you can see the examples. There's a prescription payment plan, which is absolutely wonderful for people who have expensive medications, probably for something from $500 upwards. This would be helpful. What this does is that you don't get to pay the whole amount all at once when you go pick up your medication and the pharmacist says it's going to be $167, and you're thinking, oh, okay, goodness, I'm going to be paying this until I hit that $2,000. What you can do, you can ask your plan, your insurance company, whether you're on Medicare Advantage or you're on a standalone prescription plan, you can ask them to sign you in on a payment plan. They will spread out the costs throughout the 12 months. That is, of course, if you know exactly this is the medication I'm taking, this is how much it costs me a month. I don't want to pay the whole lump sum. You put it in a payment plan. How to get into to participate in that? You have to call the plan directly. You have to call whoever your standalone plan is. Let them know that you'd like to sign into the payment plan and spread out your payment of your drugs. What this means as well is that you will be receiving a bill a month. So the other ones will go. The plan directly is going to be sending you the bill rather than when you go to the pharmacist and collect your medications. It's going to be in addition to the monthly premium. So if you have a plan that is zero premium a month, and you have your payments for your prescriptions spread out for 12 years, not 12 years, 12 months, no, 12 months at say $20, then you'll be paying $20 or whatever your monthly premium in addition to your monthly premium for your plan. Monthly payment plans can change from month to month. Why would that happen? Who knows what your doctor would put you on in June or July, or maybe they'll take you off that drug. So they will rearrange the payment schedule and make it, fit whatever medications you're taking. And what would disenroll you from a plan? If you miss a payment, then they automatically take you off the plan until you have caught up with your payments. So it's a good option for people who really need to spread out their payments and kind of leave a little bit of cash in their pocket every month. Now, you may not enroll in the prescription plan. This option is not available for people who are on limited or rather who are getting extra help. These are the people who are getting their prescription plan subsidized, the ones that I talked about, who may be getting coverage that's paid for by the state or the federal government. Or if you say you get on a very expensive drug sometime in October, it won't do any good for you because your plan will change by the end of the year. So then you really are just going to have to carry that cost if it's too late in the year. I have a link here for detailed information. If you go to medicare.gov, we'll talk about that website. Now I'm going to go through all the plans that are coming and going in Arizona. These are the standalone plans, the Part D plans we talked about. And I said, this year we had 21, next year we'll have 12. These are the plans that are leaving as you see them on the screen. We did not receive any new standalone plans. And the only two plans nowadays, next year that would be available for people with limited income are those two plans that you have. We talked about Cigna leaving the market next in a few years, but it won't be next year, but the year after. They'll still be here. And then there are changes. They consolidate their plans and give them new names, and that happens every year for reasons we really cannot explain, but to make it maybe a bit too exciting for everybody and a bit more complicated. This is what they do. They change the plan. The plan that you see, if you were enrolled in one of these plans in 2024, next year it has a different name. And we're seeing this more often as we help people with plan comparison. We look at what they have this year, and then the very same plan, maybe with the same benefits and everything, it just has a different name. I don't know why they do that. None of us know. And then let's talk about Medicare Advantage plans, Part C. These are the ones that came in the market in 1997 and decided that they can get some funding from the Center for Medicare and Medicaid Services to help people, to help Medicare maybe provide coverage as more people are coming on to Medicare. So they combine your Part A and Part B, and they also oftentimes include Part D. They have all the Medicare rights and protections, even as they are managed by private companies, and private companies are for-profit companies, so they should make a profit. But there are rules that they have to follow that Medicare says you have to cover this, and that. Your co-pays, your deductibles, your insurance, and this, as we would as Medicare that's run by the federal government, you guys have to provide the same coverage. But what they do differently is they provide extras, the extra benefits that you probably hear about more on TV. Groceries, I don't know, transportation. Mostly though, it's dental, vision, and hearing that a lot of people look for and they sign up for these plans. What you must know is that when you sign up for those plans based on the extra benefits, because those extra benefits are not mandated by Medicare, the Center for Medicare and Medicaid Services, they can change them anytime. If you sign up with this plan this year and they say they're giving you transportation, they'll pay for 25 trips to go see a doctor or something. And then next year when they look at their books and something else, they decide, well, no, we're not going to be providing free trips anymore. There's a plan that's no longer providing transportation. So if you're somebody who signed up for the plan because of the transportation, be aware that that's no longer available. Again, another reason that you want to review your plan benefits. Make sure that it's still the same as you've had this year. And if you are on a Medicare Advantage plan, you don't have to enroll in a Medicare plan. Medicare plan is that supplement plan that picks up the 20% that Medicare does not cover. A Medicare plan only works if you have original Medicare. Medicare Advantage does not coordinate with the Medicare plan. So you shouldn't be on that. And we put this on there in red because we get calls from people who say, I switched to Medicare Advantage, especially our older adults when they say, I've been on a Medicare plan, I've been paying for this Medicare plan for years. I don't know why I'm paying for it because I have Medicare Advantage. And a person has been paying for something that gives them zero benefits. You have to call them to disenroll. If you're going to Medicare Advantage and you decide I'm no longer paying I no longer need, rather want a traditional or original Medicare, you have to call your Medicare plan and tell them that you want to disenroll. Don't drag it along with your Medicare Advantage because there are no benefits for you. It doesn't do anything, but it just takes your money that you cannot use. These are the 3 different types of Medicare Advantage. You've got the HMO, you've got the HMO POS, and the PPO. The HMO is the most popular one, well known. For that one, you often need referrals to go see a specialist. So you have to have a primary care physician either assigned to you or that you're part of. They typically assign you a primary care physician. So anytime you want to go see a specialist, you got to go see your PCP first and get a referral. A lot of people don't mind that. And you have to use their network provider. And that's pretty much mostly the case with all Medicare Advantage. But with a little bit, it varies a little bit with PPO, but you have to use the network, the providers that are in the plan's network. So if you're somebody that travels a lot, like I spoke to someone who spends 6 years in Texas, 6 months in Texas and 6 months in Arizona, Medicare Advantage might not be the best option for you because you will be paying out of network prices, and the only times that oftentimes they would cover is if you have an emergency. Then they will pay for that emergency, but they will want you to come back to your network to get follow-up care. So think about those issues before you switch over to Medicare Advantage. Then there's an HMO POS. This one, as it says, it may allow you to go out of network. It's usually if you maybe Maricopa is closer to you than doctors here in Pima County, and you live on the edge somewhere. I don't know. Some people say Ajo. You may be able to sign up for HMO POS and call the plan and say the closest doctor to me is over there. They may agree to do so, but you want to check with them first. Don't just say, well, I went to the doctor who was 10 miles away from me, but you guys wanted me to come to somebody who's 20 miles away. That's not how that works. You have to check with them first and make sure it's okay. But HMO POS has that flexibility a little bit. PPO, that's the one that doesn't really require a referral. Oftentimes, you can just, you have your PCP, but if you want to see a specialist, you just go straight to see a specialist. However, they have to be within your network. You can't just go see any specialist. It still has to be within your network. And you can see any participating provider that's accepting new patients. It's cheaper when you pay with a PPO. When you use your in-network providers, it's cheaper that way. But if you are using out-of-network, of course, that will cost you paying out-of-network prices. Now, these are the changes we have in HMO here in Pima County. Just Pima County because we are on little network here. Maricopa has its own changes going on. Pinal has its own changes going on as well. We have those plans that are leaving Pima County that were here this year. They won't be available next year. And some of them are changing from HMO, becoming POS, the one middle option that may allow you to go outside your network, but you have to check with them first. Those are the two plans that are changing to HMO POS to give you a little bit more flexibility, if you would call it that. And then we have new ones that have come into Pima County that you can see the 6 plans there. And then, of course, as always, there's one that just decided to change their name. So if you were on WellCare No Premium, next day it will be WellCare Simple. Very well, it's the same thing. As you can see, the number, the ID number is the same identifying number. It's just the name has changed. I'm not sure why they do that, but they do it. And then we're on to HMO POS. You can look at this later, but these are the plans that are living, plans that are new, plans that are renamed. And for PPO, at the top, you see that the ones that are living Pima County. Again, those plans where you don't need a referral to see a specialist. And then there are 2 new ones in Pima County coming in next year. And we have the ones that have changed. They either have been renamed or the contract ID has changed. And then there's this group of special needs plan. Special needs plan are for people with chronic issues, diabetes, kidney, heart conditions. There are plans that are just tailored for that group of people. We call them Medicare Advantage special needs plans. They may include some services that other Medicare Advantage plans may not have. I'll say, for example, with dialysis, we know that they include trips to the doctor, to go to your dialysis center to get your dialysis if you're getting it out of the home. And also if you are in a institution nursing facility, they may have the option to where the provider, they have nurse practitioners or doctors that they work with who come to you while you are staying in the facility, rather than you having to worry about taking yourself to go see your doctor for your appointments. Now, in order to sign up for the special needs plan, you have to be diagnosed by your doctor. You have to show a diagnosis that this is my diagnosis and I would like to sign up for this plan. Not just anybody can sign up for it. Again, these are the changes. Chronic care for heart conditions is living Pima County, and you've got the other kidney ones that are coming in and some that have been renamed. We have a large number of plans that are for special needs, and that's pretty helpful for a lot of people. And this one is changing from HMO. They're becoming HMO POS. They are still special needs. Lung care, chronic care, and kidney, all of those are becoming HMO POS. And then there's this one that's come in, this section that has come in a couple of years ago, and a lot of people really ask us a lot about these plans. It's called a Part B give back or reduction plan. Give back, which means really, it's like a rebate. Rather than pay the entire $174.70 Part B premium, they will take less than that. Maybe they'll give you back $100, right? So they take $74.70 out of Part B. There are quite a number of those coming in next year. The give backs range from 40 cents. I don't know who would sign up for the plan so they can get 40 cents back, but there you go. And all the way up to $174.70 that they will give you back when you sign up with them. We will talk about what to consider when you sign up for plans, but it shouldn't be one of those reasons why you sign up with this plan because it gives you money back. We've seen issues, people signing up with this type of plans only to find that the care that they need really is not all that good. So there's so many things that entice you to sign up for a plan, but in the end, you want to think about your health. Do you get the doctors that you want to see? Do you is everything that you need to keep you healthy available, rather than I get a gift card, I get some money back. This is what we'll talk about. So again, before you sign up for those wonderful plans that give you all those wonderful benefits, the extras that they don't have to give you, that Medicare does not ask them to give you, the benefits that they can take them any year they choose to, these are the things you need to think about. Referrals, we talked about referrals. Are you the type of person who wants to go to your PCP first before to have them tell you what specialist to go to? Or you can figure it out yourself that I need to go see a dermatologist for this thing and go directly to a dermatologist. Those are the things to consider. The provider choice, can you go see any doctor that you want to see? Do you have access to specialists outside Pima County? If you're the kind of person that says, okay, my friend told me the best doctor is outside of Pima County somewhere else, these are the things you'd consider. Would you want to do that, or you will work with whoever doctor is available within the network? The example we like to give when it comes to that case is that the Mayo Clinic in Scottsdale, we know that they do not take Medicare Advantage. They only take traditional Medicare. Yes, they do not take Medicare Advantage. So if you're a person who's got something major going on and you say, you know what, I think I feel much more comfortable if I go to the Mayo Clinic. If you've got Medicare Advantage, no, they will not, even if you want to pay out of pocket. They only take traditional Medicare because traditional Medicare doesn't have all those barriers, doesn't have prior authorizations and anything, as long as the doctor says you need this for clinical purposes. That Medicare will pay their 80%, the Medicare Advantage, rather the Medigap will pick up the remaining 20%, depending on the plan you signed up with. We also have that you plan to travel. We talked about the networks. It confines you. If you're a person who spends 6 months somewhere else, Medicare Advantage, again, may not be the best thing for you because you want to stay somewhere. If you break your ankle, you go to an emergency room, they set your ankle properly, and you want to stay at home and go see the physiotherapist available in that place, rather than have to come back to Pima County to get your follow-up care within your network. So that's two different options you have there with your Medicare Advantage and original Medicare. The other things to consider, as you say, your health concerns. What are your current and future health concerns? We talked about this when we talked about your prescription. Some people say, I'm not signing up for Medicaid, for prescription plan because I'm not on any medications right now. I'm 65 and I'm healthy. Come to find out 2 years, 5 years down the line, now you have to sign up for a prescription plan because you're now on this expensive medication. And on top of that, you have this penalty now for not signing up for 5 years when you should have. So do consider that. Your family's medical history, the likelihood of you having something that somebody else in your family has, must be part of your decision process. Now, keep in mind that if you are under 65 in Arizona, you cannot purchase a Medigap plan. So that kind of pretty much puts you in Medicare Advantage. You can sign up for a traditional Medicare plan if you're under 65, but what that means, you'll be responsible for the 20% that Medicare does not pay. So oftentimes people will sign up for a Medicare Advantage because they get better coverage that way. Until they turn 65, then they have the option to pick up a Medicare plan. Additional benefits, we talked about the hearing, vision, dental, free gym membership, silver sneakers. Again, we advise you to not make this to be the reason you choose a plan if you're going with those plans that offer those benefits. And that's because they don't have to. These are just extras that they give you to sign up for their plans. Now, how do you choose between a PPO, HMO, and an HMO POS? You look at the network. How large is the network? Are your providers and the people that you already work with, especially when people turn 65 and they say, I don't know whether to go with traditional Medicare or go to Medicare Advantage, we say, well, do you have specialists that you've been working with? If you're a person who's been having health issues, if you've got a specialist that you work with and you prefer to work with, if you have a primary care physician that is who you'd rather be with, the first thing you have to do before signing up for a Medicare Advantage plan is to ask them if they accept that particular plan that you're leaning towards. Because what you don't want to see happen, that we see quite often, is you've signed up for a plan that you thought was a good plan, it works for you, and then you go to your regular doctor and they say, oh no, we're not contracted with that plan. So check with the doctor first, or your providers first, before you choose a Medicare Advantage. Prescriptions, are they in the formulary? There's a way to check that. We do that for people if they need assistance. If you take a long list of medications before you choose that plan, because we talked about this $2,000 cap that you can only take advantage of if your medications that you're taking are in your plan's formulary. And that also includes the $35 insulin copay that started last year in July, that we talked about a lot last year, that people who are on insulin and the copays are now capped at $35, but only if the insulin you're taking is within your plan. If you're taking insulin that's not part of your plan's formulary, then you may have to pay whatever it is that they charge you for, and you cannot take advantage of the 35%. That's what we're here for, to clarify it for you. If you're not sure, just give us a call and we'll look it up and tell you, what are you taking? We'll run a plan finder for you. We'll put in all the medications and say, it covers all your medications except for this one. Let's look at other plans. Luckily, we still have a few options to choose from. Travel. Do you plan to travel? Again, do you spend 6 months at another place out of state, or 6 months in Flagstaff, or 6 months down here in Arizona? Those are the things to think about, because if you're on a Medicare Advantage plan, except for a few that are larger, oftentimes you may find that when you are out of your network area, you only get care on an emergency basis, and you don't want that. The cost with Medicare Advantage, usually there's no cost outside of the Part B that you pay them. But there are plans that would have Part B premium plus a little bit more. That's why we said, I think the premium goes all the way to $158. So you pay your Part B that everybody pays, or who's on Medicare, and then you also additional amount. Now that depends on what the plan is giving you. Those are the things to consider. And then there's a star rating, the star quality that is very important. The spreadsheets that we have the ratings on them. You want to make sure that that they have good rating. This is something that insurance companies really do fight about with CMS. They sue them and say, you didn't rate me well. The rating comes from the providers. It's information coming from the providers, coming from the Medicare beneficiaries. They look at everything and come up with this rating system that comes up to 5 stars. So if you're in a plan that's maybe 3.5, then maybe you're good. If a plan has been on 3 stars for 3 consecutive years, Medicare, the Center for Medicare and Medicaid Services, asks them to send you a letter letting you know that they've been sitting at 3 stars. So you have to think whether you still want to continue with them. 3 out of 5 for 3 years, they have to send you a letter telling you that their rating hasn't gone up. So 3.5 is pretty much the rating. And all the way up to 5 stars. If we've got a plan that's 5 stars that we don't have, we had one, I think last year, just one. It's so good to have that, so much so that you get a special enrollment period. If we find out there's a plan that's coming up that's 5 stars, you can ask for special enrollment and say, I want to switch over to the plan that's 5 stars. That's how serious the stars are. And it's so serious that even the insurance companies will take the Center for Medicare and Medicaid Services to court to argue about their ratings. So when to enroll, this is open enrollment. Even if you've been on Medicare for a long time, this is the time to always review your plan and make sure that you look at your annual notice of change. If one was sent to you, what did they tell you? Are the premiums still good for you? Are the medications they're taking still in your plan's formulary? This is the time to review those plans. You can change Medicare Advantage plans again. This is the moment. And whenever you make all these changes during this time, they will take effect on the 1st of January. This is for 2025. Medicare Advantage open enrollment picks up again on the 1st of January until the 31st of March. This is for people who are already enrolled in Medicare Advantage. They can switch plans still at the time. So that one of our presenters calls it a second bite of the apple. You can still switch plans, switch plans from Medicare Advantage to another Medicare Advantage plan, or you can drop your Medicare Advantage and come back to traditional Medicare and pick up a standalone prescription plan. We do see this happen sometime around February. People go see the doctors in January. That's when they realize that, oh, I don't like the way this is. And then they, lucky for Medicare Advantage, they can still switch. What you cannot do during that period, the first quarter of January, is to switch from traditional Medicare and pick up a Medicare Advantage. If you want to go to Medicare Advantage, this is your moment up until December 7th. You will have that until the end of the year. But if you're on Medicare Advantage in January and you want to come back this way, you can drop to traditional Medicare, you can drop it and pick up a standalone plan, prescription plan. I'm sure you all are familiar with this, how to enroll. You can call 1-800-Medicare. We do this all the time. We help people to enroll and drop a plan. I helped somebody yesterday who said, I have TRICARE for life. I don't know why I have this Medicare Advantage. I have TRICARE for life and I don't use this Medicare Advantage. I want to drop it. We call 1-800-Medicare and say, I want to drop my plan. I'm going to go back to traditional, leave my traditional Medicare and stay with my TRICARE for life. They're happy with that. Or you can go to Plan Finder at medicare.gov if you're comfortable with computers and go enroll there. Look at the different plans. There's a button you can click on, enroll, and sign up for the plan that you prefer. You can contact the plan directly. We have the numbers on the plans on the spreadsheets that we gave you. Or you can use an agent and broker. Believe it or not, there are many of them who are very good and they do wonderful work. And if it's somebody you've been working with for a long time and you're quite comfortable with them, there's no reason why you can use them. They have their best interest at heart. Of course, there are those that are unscrupulous, and that's why we have the flyer that tells you what brokers can and cannot do. But really, there are wonderful brokers available. We just don't work with them. We don't have a list of names that you can call. So no, we can help you in that part. To enroll in Medicare, you must have both Part A and Part B. And to enroll in a standalone plan, we talked about this earlier, you either need Part A or Part B. You don't have to have both. This is the Medicare Advantage, or rather the Medicare.gov website. That's what it looks like. We have the big red arrow showing you that you don't necessarily have to create an account, because you see the first side says log in or create an account. Not necessarily, you don't have to, but it's a good idea to do so if you're already on Medicare, because then you will see everything, all your medications as they change, as they get added and dropped. You can see your explanation of benefits in real time. It's almost like online banking. Your information, Medicare information is sitting there. But you can also just go in and look for plans without signing in and creating an account. That's the second option. We use that one a lot. And you can fill out that information and see plans that are in your area. It's pretty straightforward. It keeps getting better. It's so far advanced than it was before the pandemic. I think during the pandemic, everybody said, we really need to ramp up our technology. It is so good. It makes our work very easy. Anybody can, you just plug in information and press search, and it gives you a whole list of plans. Even when you're looking for providers in your network, providers in your area. Somebody called me the other day needing a wheelchair. Who's going to say, I need to go to a Medicare certified provider to get a wheelchair? We went in there and looked to see who sells that wheelchair, any other durable medical equipment. You will find that information there. Prescription plan coverage. We talked about how you can save on prescriptions. You have look at the different pharmacies. Medicare.gov will tell you which pharmacies are preferred, which ones are network pharmacies, which ones are out-of-network pharmacies. That's the good thing about using that website, because you can see the different costs depending on which pharmacy you go to pick up your medication. Again, we can help you with that. There are also other options where you can get discounted prescription by going to goodrx.com and NeedyMeds. These are the websites that you can look at before you start paying. Sometimes the prescription, they find people they are cheaper at GoodRx than they are if you were to get them from your pharmacy, and you think I'll just pay $3 here. Then if I have to pay, I don't know, $5 at the pharmacy, it's up to you. Really, you do have choices and options. Another way of saving on your medications, if you find yourself in medications that are very expensive, you can ask. They don't always will agree to change the tier at which your medication is covered. Ask the plan, ask for a tiering exception, or you can ask your doctor about samples. I'm sure you guys already know that, but you cannot live off of rely on samples for a long time. Eventually, you will have to get some kind of arrangement to get the prescription. If your medication is not on the formulary, not because you did not review your plan, as I keep saying, review your plan. If it's not on the formulary because sometime in August next year, your doctor puts you on some medication and it's the best medication for you, but it happens to be not in your formulary, you can ask for a formulary exception because that's not your doing. They don't have to agree to that, but it is an option. Ask them, I need a formulary exception because now my doctor, I signed up with your plan and this is not in your formulary. Could you accept this one? Then you can talk to your pharmacist. I'm pretty sure you're familiar with talking with your pharmacist, see if there are generics that you can try, or your doctor as well. There are ways of saving, Medicare savings program. We don't have those flyers, but I have more information on that. We can send those handouts. You've probably heard of people with limited income who have both access and Medicare. We can help you apply and see if you qualify for those services. There are different levels that you can qualify at. Specify low-income Medicare beneficiary that will pay for your Part B premium and subsidize your medication. Same with QI1, qualified individual will pay for your Part B premium and subsidize your medication copays as well. And that also include extra help that we talked about, that if you sign up in extra help, you cannot then sign up for the give back plans that give you some money back. And we're almost done. Let me see. Look at the time. Okay, got 7 minutes. And there comes the part that we really, really deal with all the time. We know that people are calling you. We know that there's aggressive marketing. People want your business. People want to make a profit. People want your information out there. And you're going to keep getting calls. All I can say is do not answer calls from numbers that you don't recognize. Just let it go to voicemail. And if they really must talk to you, they will leave a message. But do not pick up the call. Do not pick, because it's not even like it's an individual person that's calling you who's picking up the phone and dialing. It's now done by computers. We've sat in meetings with people and you hear the phone just ringing every 3 minutes, every 5 minutes, and you know that their name is out there. So you just want to ignore calls that you don't from numbers you don't recognize. And if it's somebody that you know, then they will leave a message. Even when we call you, by the way, when you call us and then we call you back, we are okay with you not picking up the phone, but we will leave a message and let you know, this is Linda. I'm calling you from Medicare with Pima Council on Aging, and then you can then call us back. There are marketing guidelines and rules I talked about. I said they're wonderful agents in Pima County and everywhere, but there are those who also, they get paid on commission. So sometimes there's going to be some unscrupulous people who will have you sign up for something that may not be good for you. It's good to know what they can and cannot do as they're selling you their plans. And if you have somebody selling you something that you were not, or rather you think there's something off about this, give us a call and we will verify it for you. Because we have to report them, by the way. And then it also goes to the star rating. So we have to report those people. This is an example of an envelope that some mailing that somebody received at home. It looks like it's an official envelope for Medicare savings program that I just talked about. But if you read the fine print, you will see that it says this is not an official notice from the government agency. What is going to happen if you do respond to this? Now they have your information. Now you have a whole bunch of people calling you for something that you truly don't need. The other thing that's very important is reading your Medicare summary notices. These are the statements you receive when you've received services if you're on traditional Medicare, or your explanation of benefits, which you will get from your standalone Part D prescription plan or from Medicare Advantage. The reason you do this, you want to make sure that everything that's listed on there, you actually did get those services. The other thing that's very good, I helped somebody with this yesterday, is it also tells you how to appeal a claim that has been denied, because claims do get denied. Had somebody who had a claim that was denied, and we looked at their Medicare savings, rather a Medicare summary notice to see why the claim was denied. And so we know exactly what to address when we respond. And in Medicare summary notice, we'll have a page that tells you exactly what you need to do to appeal a denied claim. And it will tell you that you have 180 days. Here's your deadline. So you need to follow those instructions. So it's very important to open the statements when they come in and just double check to make sure that you did receive the services. It was on the right dates, which was the case yesterday. The dates were incorrect. Did you get the services listed? Do the bills that you're receiving from the doctor, are they what Medicare says you should be receiving? Just double check first before you start paying your doctor bill, unless you know for sure that's what you owe. Make sure that your insurance company agrees that this is how much you should be paying. What else do I want to add on here? This is how we got to find out that people were getting those COVID tests that they didn't. Remember when people were getting a whole bunch of COVID test kits that they didn't ask for?
Right.
And when you get the whole bunch delivered at your door, and then they look at their statements, it says Linda ordered 70 test kits that they did not order, which meant somebody had their Medicare number and they were just sending them test kits and collecting money from Medicare. That's how we found out, by looking at the Medicare summary notices. In addition to people calling us saying, I'm receiving this, I didn't order them. So it's important to look at your statements. And we have the additional helpful resources, how you can reach them. These are really, really good. Medicare advocacy down at the bottom has wonderful YouTube videos where you can get snippets of information that you're looking for. So be sure to check them out, all of them. They're really, really great. And this is my last slide. Help is available. This is what we do. We are a team of 3 paid staff, myself and 2 Medicare specialists, 1 bilingual. And then we have a wonderful team of 15 volunteers that work with us who are retired. They live here in Pima County. They are also on Medicare, so that when you talk to them, you're talking to somebody who already knows. They too have to review their plans every year. So feel free to call us or call Jennifer here. We come here every Friday whenever somebody wants to have a one-on-one appointment. From 10 to 1, we have those hours blocked. Anytime you call them and say, I need to talk to somebody one-on-one and it's closer to come here, we are here. We are here to help you. All right.
So thank you, Linda. I do have a couple of questions. I mean, that was a lot of information so I can understand. It's confusing. I mean, so it's great that you have folks that help everyone to sort of navigate the Medicare system and, what may be in their best, what works best for them.
Right.
So one of the questions that I had was, how soon before your 65th birthday should you start looking into Medicare plans?
Oh, okay. You have your initial enrollment period runs a gamut of 7 months. It's the 3 months before your birthday month. Your birthday month is the 4th month, and the 3 months after your birthday month. If you sign up for enroll for Medicare on the 3 months before your birthday month, Medicare will take effect exactly on the 1st of your birthday month. If you sign up on the birthday month and the remaining 4 months, anytime then, it will take effect on the next month. Does that make sense?
Okay.
You have 7 months.
Great. Okay. Now, what if somebody is still working do they need to sign up for Medicare, or what happens if they delay enrollment because maybe they're covered through their employer? What's the best way to navigate that?
It's absolutely possible, and a lot of people do that. You can delay your Part B enrollment because you have to pay that premium. But if you have your employer coverage, you don't have to sign up for Part B. You delay it. However, here's something you have to be mindful of, and that we have to caution people. To delay Part B enrollment because of your employer's coverage, your employer has to have 20 or more employees. If your employer is a small, nice little niche company with less than 20 employees, then you have to sign up. You don't have that option. If you are somebody disabled, it has to be 100 employees and more. If there's less than 100 employees and you are a disabled individual, then you have to sign up for Medicare.
Okay, great. Now, when you're on Medicare, does it cover any kind of long-term care?
No.
Okay.
Medicare does not cover long-term care. They go as far as hospice, but for long-term care, there's a different program called Altex, and Pima Council on Aging provides classes just like this on Altex. So give us a call and we'll direct you to the right people to learn more about that. There's a lot involved in that, with the resources and spending down and all of that. No, Medicare does not get involved.
Okay, and obviously, I think you need to look at each of those plans to see exactly what they cover, as you mentioned, whether if they're covering durable medical equipment and how many days, if you have to go into rehab or, a skilled nursing facility, then you need to look at all of those.
Right.
Right. Okay, great. Now I want to go ahead and put up on the screen for everybody at home, if you are interested in a Medicare appointment, you can contact us here at TMC for Seniors, which is 520-324-1960, or call Pima Council on Aging for an appointment, 520-546-2001. Linda, thank you so much for being here today. I'm going to wrap up with our online audience, and I'm going to turn it over to you to answer any questions that come in from our in-person audience. So thanks again for being here.
Thank you, everybody. Thank you.
Thanks again. We will be back tomorrow for Diabetes Day. We've got a big day tomorrow with 2 presentations. Starting at 9:30 a.m., we'll have a presentation on navigating the world of diabetic medications, GLP-1s, from 9:30 to 10:30. And then we'll be back online for a second class, which is Fiber, a powerful tool for blood sugar stability. And that will start at 11 a.m. If you're interested in either of these classes, please give us a call in the office. Our phone number is 520-324-1960. We'd be happy to get you registered if you're looking to attend these online. Tomorrow's class has filled for in-person, but you can still watch it online. We look forward to seeing you then. Thank you.